1 in 5 American adults are currently living with a mental illness. Less than half of them have gotten treatment for it in the past year. It is no doubt a crisis across America, one we cover often here on this show because it affects everybody of every age at every part of this country, every geographical area, even members of one of America's most prominent political dynasties. Patrick Kennedy is a leading voice in mental health and addiction policy, drawing from his own experience in recovery. A U.S. congressman from Rhode Island, he co-authored a bill that required insurance companies to cover mental health and substance abuse treatment like they would any other treatment for diabetes or for cancer. Now he has his sights set on enabling more Americans who are struggling to get the help they need. He follows in the footsteps of his uncle, President John F. Kennedy, whose Pulitzer Prize-winning book, Profiles in Courage, shone a spotlight on those U.S. senators whose work literally changed America. Patrick's new book is about mental health and a diverse group of individuals with the courage to take a very private battle public. His book is called Profiles in Mental Health Courage, and it's out now. Joining us now is former Rhode Island Congressman Patrick Kennedy. Great to have you on the show.
Thanks, Elizabeth.
This is such an important issue. We've covered it so much, especially for our younger generation.
Right.
I mean, our young adults in this country. I have 2 kids who are in that age bracket.
Right.
Mental health is a serious, serious thing.
No
and yet
question.
people can't get the help they need. Why not?
Well, we've never paid for mental health. It's the lowest reimbursed service in the healthcare system.
Even after your bill.
Well, my bill basically says that, you get the insurance coverage, but what the insurance companies still do is they pay such anemic wages.
Hardly anything.
If hardly anything, a lot of people have to go out of network or pay cash. And we're about to fix that. President Biden has a rule that now calls for increase in pay, calling pay parity. And he also clamps down on medical management practices like pre-authorization that unfortunately still land too heavy on people trying to get mental health and addiction coverage.
I love the fact that your Profiles in Courage, it takes off on your uncle's book, Profiles in Courage, JFK's book. I did not know that of the 8 people profiled in Profiles in Courage, 4 of them had mental health or addiction issues.
Those are the ones we know about. Now, John Quincy Adams had 2 brothers die of alcoholism. His oldest son took his life at 28. Sam Houston, another featured profile, was known as the Big Drunk. We had Daniel Webster, died of cirrhosis of the liver. The point is that these are not new issues, right? They've been going on since the beginning of time, but we're just starting to talk about them. But what we're not doing is talking about them in depth. We're not talking about how messy, complex, difficult it is to negotiate personal relationships, work relationships. And that's the part that I wanted to put out there, because everyone's saying, oh, I have a diagnosis, or I'm in recovery. But for people who are suffering, they don't know what that looks like. So what it makes them feel like is more alone, because they think their problems are unique.
Yeah.
And of course, those of us who are in recovery have a big book in our 12-step program, and we get to read about people who are just like us from different walks of life. In this book, we have 12 people, different walks of life, different backgrounds, all suffering from, by the way, different diagnoses, but having a common struggle with respect to getting insurance, trying to negotiate an intimate relationship with their spouse, with their kids. Many of them had me speak to people who they don't speak to anymore just because they were so committed to getting the full picture out there. And they are courageous in doing so. And they use their real names. I just want to make clear. That's what makes them so courageous.
These are real people, real stories, going through real struggles that probably everyone in our audience, if you haven't gone through it, you know somebody who has. And it's also something, this has ravaged your own family. I listened to a great interview you did with your cousin Maria Shriver, who's an old pal of mine from NBC. And you talked about your mother's struggle and the fact she had such a very public struggle with alcohol addiction for decades. And you actually really, you began to investigate her own life. And you told Maria you actually felt bad that so much of your life you spent feeling ashamed and embarrassed of your mom.
You know, I grew up, like many, trying to hide the fact that my mother was an alcoholic when everybody knew.
It was on the front pages of the newspapers.
But, you know, that's true of everyone. We try to hide this, which is the reason why we need to get people to feel less encumbered and more open about talking about it. Every story, especially my cousin Mark, who I featured in this, who lost his 19-year-old to suicide, nobody talks. Mark did not know what his other son, Belton, knew. Belton didn't know what Harry's roommate in college knew. And the point is, if any of them had ever talked to each other, not feeling like it was violating their personal space, they would have had a much clearer picture on what Harry was going through. And then, you know, you read about these school shootings and everyone says, oh, I never knew it was that bad, or oh, I thought it didn't rise to that level. This is all a case of we need to talk more openly. And we can't wait till it's a crisis, which unfortunately is where we are in this country. We don't treat people until it's a stage 4 illness, and we don't get people help until, frankly, it's almost too late. And then we wonder why so many people are dying of suicide and overdose.
Thanks so much for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.